welcome to our Monday Minute. Today we're here to share some good news with you in that the face-to-face encounter being done via telehealth has been extended through September 30th of 2025. The extension allows both home health and hospice to continue to conduct face-to-face encounters on home health's behalf, except an encounter from a practitioner that is done via telehealth, where that telehealth platform being utilized is HIPAA compliant, and there is documentation in the encounter note that the encounter was both audio and video. It cannot be audio only. With this extension, we are also working on legislation that could potentially extend telehealth allowance for face-to-face encounters permanently, but that is not the case at this point. In addition to that news, I wanted to share with you a couple of things. The top reasons why face-to-face encounters are denied for home health, and the same for hospice. For home health, the two top reasons that face-to-face encounters are denied under medical review or non-affirmed during the pre-claim review process is due to the encounter itself not being completed by an allowable provider. Make sure that you are very clear if a patient has been admitted into an inpatient facility to accept the face-to-face encounter from that facility would have to have discharged that patient directly to home health. In addition, if it is a community face-to-face encounter, that must have been conducted by the certifying physician, or if an MD is certifying the patient, the face-to-face could be done by a nurse practitioner working under that MD. In addition, the second reason for denial is that the primary diagnosis for the home health encounter, for the home health admission, was not treated during the face-to-face encounter. So on that encounter document itself, it must be documented that the patient actually received treatment from that physician or practitioner, and it be the primary focus of the home health episode. The top reasons for face-to-face denials for hospice, number one is that it doesn't happen timely. Of course, a face-to-face encounter must happen within 30 days prior to the beginning of the benefit period in which it is required. Third or later benefit periods all require a new face-to-face encounter for each benefit period. That benefit period or that face-to-face encounter again must have occurred within 30 days prior to the beginning of that benefit period. In addition, we also see denials for lack of adequate documentation within that face-to-face encounter to support the ongoing terminal prognosis of the patient. Also keep in mind that the face-to-face encounter content for a hospice patient must be utilized in the preparation of the clinical narrative of the certificate of terminal illness. It is very, very important that whether we are talking about home health or hospice, the face-to-face encounter is giving the appropriate focus, and that you are positive as you enter into the episode for home health or the benefit period for hospice, that you are confident that you have the appropriate face-to-face documentation in order to support your patient's situation if you were to go under any type of medical review. Healthcare Provider Solutions stands ready to assist with any face-to-face encounter issues that you might have. Please let us know if we can assist in any way. Have a fabulous day.